Pilots. I am an occupational therapist and owner of Threshold Therapeutic. I am back with my community partners at CareWorks Mobility today to talk to you about a topic of how to choose between a sit-to-stand lift and a Hoyer lift when you're thinking about patient lift systems. Choosing a lift is highly dependent on, one, the person that is going to be physically in the lift, and two, what is the goal of the use of your lift. So the first thing I want to talk about are the physical requirements for use of both lifts. If you are considering using a sit-to-stand lift, again, we talked about how a sit-to-stand lift is designed from helping someone go from a seated position to a standing position. There are a few physical requirements that need to be considered. One, a client who's using a sit-to-stand lift must physically be able to bear weight through both legs safely and without significant pain. So if your client has really sore knees or arthritis or they're non-weight bearing, this is not going to be a proper choice for you. Two, the person who is using the lift must have adequate trunk control to be able to sit on the edge of a bed or the edge of a chair with very, very little physical assistance to be able to be safe during that sitting and standing process. Three, the person who's using the lift must be able to cognitively follow cues and directions while in the lift. So if you have someone who gets agitated or gets really anxious during a transfer, sit-to-stand lift is not going to be the most appropriate option for you. If we are looking at a Hoyer lift, there are actually no physical requirements for use of a Hoyer lift. Absolutely everyone can be appropriate for a Hoyer lift. There's no weight bearing restrictions, there's no trunk control restrictions, and if your loved one has cognitive impairments or if they get agitated, they are going to be perfectly safe in the Hoyer lift because the design of the sling is like a hammock. It snuggles them in a cocoon to keep them safe during that whole process, no matter what their level of physical impairment are. So those are the physical requirements for use of these devices. The second thing that you want to consider when choosing a lift system is, what is the goal of your transfer? Meaning, what is it that you are looking to happen when you're going from one place to another? So if we're thinking about a sit-to-stand lift, the goal typically of clients who use this lift system is for the client to be able to participate in the transfer process as much as possible. When someone is in a sit-to-stand lift, they actually physically have the ability, if they need or want to kick in some strength in their legs to help with that standing process. It allows them to continue to participate in their self-care routine in a way that is very similar to how they would have done that before they used the lift system. So in a sit-to-stand, because the design of the sling is basically a strap that's about this wide that goes around the waist, it allows for more independence and flexibility for use in the bathroom. It allows caregivers to be able to assist with clothing management, pants up and down, and hygiene in the actual bathroom setting, given that slim design of the sling. So if that goal is for the client to be able to continue to participate in their routine as independently as possible, then that would be the goal of someone who is looking to use a sit-to-stand lift. If the goal is for the client to be as safe and as physically comfortable as possible to get from point A to point B, and who may not be able to actively participate in the physical transfer, then the Hoyer lift is going to be most appropriate for that client. So if they're not able to bear weight through their legs, if they're not able to cognitively participate in that process, the Hoyer lift is going to provide the absolute most comfort and safety for being able to do that device. You can use a Hoyer lift for assisting with getting someone safely to a commode or to a toilet, but given the design of the slings that come with the Hoyer lift, there are going to be much more limitations to how caregivers can help with clothing management and hygiene. That typically requires a few extra steps where caregivers have to take care of clothing management at the bed level, then put the client in the sling, and then take them to the toilet or to the commode, which can add a couple extra steps to that process. It is possible, but it would also be the safest method for someone who is otherwise unable to handle a sit-to-stand lift. I hope you found this information helpful on how to choose between a sit-to-stand lift or a Hoyer lift. If you have any reservations, questions, concerns, This is the type of decision that is best made by a care team. That would include the patient if they are able to help in that decision-making process. It would be between the at-home caregivers if friends or family are providing care, additional paid caregivers as well, because everyone needs to be able to use the lift. If you have any questions or concerns along the way, this is a great time to reach out to a home care therapist, either an occupational therapist or physical therapist, to give you guidance on how to choose a lift and how to choose a sling. They will be able to give you expert information on what's going to best match the physical needs of the client using the lift, as well as which lift is going to best fit in your individual home environment. For additional information, please feel free to head over to our blog at thresholdot.com for some more information on lift devices. Thanks so much for joining us.
Thanks so much for watching the Home Care OT. Please like and subscribe to keep up to date with our video content, and head over to our blog linked below at thresholdot.com.